Assalamu alaikum and good evening. Welcome to another episode of Health is Wealth. I am your host, Hzw. How are you this Saturday evening? Hoping you're having a great start to the weekend. And also, in accordance with our program, staying happy and healthy and looking after all those health issues that we're talking about. Okay, today's program is a bit different. We've got a really fascinating topic for you today. And the topic today is digital health. What is digital health? What is its relevance to us as, Pakistanis? What can it do for us? How can it help us? What needs to be done? It's something that is really interesting and something that is so beneficial that we need it here. And how can that happen? And what are the sort of intricacies behind that? I'm very happy to have with us in the studio our guest, who is Dr. Hzw, Chairman and General Partner of Hzw Co. Thank you very much for joining us.
Thank you.
Okay. Now, the question that everybody who's watching this program right now, well, many people, if not the people who are familiar with it, would be that what exactly is digital health?
Digital health is actually, at the basis of it, is digitization of your healthcare delivery. What that really implies is that we are trying to use the newer methods, the 21st century, especially methods of communicating and assessing and trying to provide treatment regimens through these new methods of digital communication. This would lead to a number of things that I will use the words and I'll try to explain a little bit.
Sure.
So digital health, at the base of it, is first of all digitization of your medical health record.
Okay.
So that's the first step.
That's first
step. There are two ways it's described. One is called electronic health record, which is basically all of your health record. And electronic medical record is your one instance of interaction with the medical system.
Okay.
So this is at the base of everything.
Okay.
Then it builds up from there. There are different aspects, which is wearable devices, which a lot of people would be familiar with. They may have their Fitbits, which count their steps and blood pressure.
So many people are actually using the digital health without actually, knowing about it. But then they would also swear to, how beneficial it is for them.
Exactly.
I mean, something like that is just a tip of the iceberg.
Tip of the iceberg, because I'm going to use a little bit of few words that would then actually go into that. Telemed, which is your communication with the physician, which is away from the site.
Okay.
So that's also mobile health. This is again using the phone, smartphones, to provide you healthcare. But I think at the base of all of it is what we call patient engagement. All of these methods, like social media, which put a lot of grandmas in touch with their grandkids from other parts of the world. If you think on that same term, it's the same thing in the sense that it's allowing your care managers or caregivers to be in touch with you and communicate with you while you are interested in your own healthcare problems.
Which makes sort of sense because you are the biggest stakeholder in this.
Absolutely.
So you would want to be empowered.
Yes.
It's also empowering,
It is empowerment. Patient engagement is all about you being in charge of your own healthcare. And this should what we call be applicable throughout the patient journey. So patient journey in each country is different. This is from the point the patient has any pain to their first appointment, to their labs, to their treatment, to their recovery. This whole thing is called patient journey. Okay. And the whole idea about digital health is that we manage that patient journey to its maximal effect and allow people to get better, quicker, and with more quality of life. So there are basically two pluses of digital health. One is obviously it roots out inefficiencies in the system because now you have data, you have knowledge, and you can cut the cost where you are wasting money. On the other hand is that you get better quicker and you have better quality.
Right.
So those two things are basically what we say drive value. This is value is not just a word like a regular word, it's a term of art in healthcare. So you drive value within the system.
Okay.
So
right. So basically you're also saving a lot of time and money.
Absolutely, absolutely. So this is where the challenge comes. You know, Pakistan, actually a lot of countries, inclusive, are resource-poor environments. Pakistan basically literally spends only $53 per person, as against US, which is the highest, which is $7,500. A lot of other developing countries spend a lot more than Pakistan does.
Okay.
So when you have less of money, you should find ways to better use it.
Absolutely.
So in resource-poor environments, this becomes even a bigger imperative to focus on ways to better utilize what you have and provide a better quality and care for the patients.
Right, okay. Now, having said all that, to make it a bit more relatable to our viewers, you know, well, we're going to discuss this as well, and right now, let's show you a report about the various devices and things that can help you.
If you're online, the internet can play a big part of your daily life. With a PC, tablet or smartphone, you really can have the whole world in your hand. You can go shopping, do your banking, buy tickets for travel, get information, or simply keep in touch with family and friends. There's a lot you can do online when it comes to taking care of your health too. From apps to help you boost your well-being, to potentially connecting with your GP surgery. The option of booking appointments with your GP or ordering repeat prescriptions will soon be available to more people. And, in the future, you'll be able to access a summary of your medical record online, along with other services and information, perhaps through just one website or app. Your medical record will be more joined up, bringing together information held by your GP practice, any hospitals you visit, and eventually any social and community care services that you access. The record will also be available to appropriate professionals involved in your care, so they can securely share and see your information whenever this is useful. Joining things up in this way could help improve the support you receive and your healthcare experience. Having access to your medical record could make you more informed about your healthcare and about your conditions, and help you manage them better.
Okay, hope you found that, you know, a bit more informative for you. So, you know, Dr. Z, if I could just ask you this. Here's our smartphone. Nearly everybody, whether they're smart or not, has a smartphone. So, you know, this phone is with us all the time. It seems to, you know, also be a sort of a, everyone will be complaining, you spend more time on your phone than you do members of a family, friends, you know, whatever. How does digital health find its way to my phone?
Okay, so I'll give you a simple example, and I hope that helps people to understand. A lot of people have diabetes, so they need to monitor their sugars on a constant basis. All right. In most of the Western countries, there are Bluetooth devices where they measure the blood sugar. It uploads to the app directly.
Okay.
So now you have data constantly accumulating within the app.
So you're using, if you're testing your insulin levels, your sugar levels, you'll do that with your
regular
kit.
device.
Regular device, which again is digital health.
Is digital,
part of digital health. Okay. So you check it there, and then where do the results go?
It gets uploaded within the app.
Okay. Where it's stored.
It is stored.
Right.
So you have historic data. Then you add what level of insulin did you say you injected, or a lot of people in US and other places have insulin pumps that communicate via Bluetooth.
Again, digital health?
Exactly. This is all part of the digital health.
Right.
And then it allows to better manage yourself, your condition. So this, again, diabetes is very prevalent in Pakistan. So this could be, and the problem with diabetes is that you have to maintain a very good level of your sugars to not have the adverse effects.
Right.
So too low is bad, too high is bad.
Of course,
so that allows you to better manage what we call chronic disease management. So it could be high blood pressure too, which is another huge issue in Pakistan. So
where you would have your digital reading as well,
exactly.
and then
that adjusts your medication, then what kind of...
And this app would be tailor-made, of course, for every person who is using it. So they would have their own...
Exactly, in the sense that the app is there, you know, the data is yours.
Right.
That's what makes it tailor-made for you.
That's what
The
makes it
response
unique.
is what the response will come out of that collection of data is where it becomes tailor-made for you.
Okay, another important, sort of part of this is that it's very, it's very helpful for the preventive side as well, isn't it?
Exactly, because
Preventive
knowledge
medicine.
is key, and again, I go back to the whole concept of patient engagement. Patient engagement is not only intervention. When a bad thing happens, then you just go and do something about it. The whole idea is that you can actually manage the diseases much, much better when you prevent them in the first place. So
true.
Exactly.
If diabetes is in the family, you'll know that, that's something you've got to look out for anyway.
Exactly.
So you'll be more vigilant.
Yes.
Yeah.
Yeah.
And then if you have the data to assist you with that way,
Yeah.
then it's making your life easier.
Exactly. And then you can layer it on another concept, which is adherence. So adherence is where people, when they are given, so a patient comes in, I prescribe them a medicine. Even in US, which is the most advanced in the healthcare delivery system, only 45% of patients take their medicine.
Only 45%.
Yes.
That is not a figure that you'd really think would be,
Exactly.
Relatable
Yes.
to.
And so one of the impacts we are having in US is that these digital health applications are actually helping to monitor old people. Because caregivers or children are far away from their parents. And as the older population increases in Western societies, they are finding that they are not taking their medicines at all.
So the children can also monitor?
Exactly, because
Okay.
they can see that if the blood pressure was taken or not.
Okay.
They are part of what they call caregivers
Oh, right.
network.
So they're sharing that information.
Exactly.
Okay.
Yeah. So
okay.
this is, and the big issue is communication. A lot of things get lost in communication.
Yes.
If you can only go to your physician in 1 month and you have to wait the whole day in the lobby to see them, it takes the whole incentive away of actually really having a dialogue. But when you have this kind of data being collected, there are other people who are very interested in making sure that you have a good outcome from all the treatment regimens you are taking. And in this really helps a lot of people in healthcare delivery to their older relatives because they can see even from far away how well they are being managed and is that being done properly or not. So I think the permutations of this are immense.
It sure is.
In every aspect
Right.
of how care is given and how patients get better.
As we spoke before, before we started recording, we spoke about, you said that, okay, what you actually need is the data.
Yes.
That's where we have to start from. And the data that you just gave us, that only 45% of people will be continuing with their medicines properly in the US. If we wanted to make a comparative study, where is the data in Pakistan?
There's no data. Data forms the basis.
Yeah.
So again, people can understand before, like we were talking, before NADRA, there was no digitized records of people in Pakistan.
Yes.
Now we have digitized records.
Yeah.
Now you can start seeing who is how much old, who lives where, who does what.
Exactly.
Which was not there before.
There's a record now.
Exactly. This is the same thing. The EHR or EMR becomes the first step in trying to identify the problems. If you don't know the problems,
What does EMR stand for?
electronic medical record,
Okay.
electronic health record.
Okay.
Health record is your
Right.
whole journey.
Right.
Medical record is one instance.
Right.
So because EMR can be generated at different sites because one patient may end up going at 3 different physicians.
Right.
EHR will be with them throughout.
Constantly. That's one of the constant
because
factors.
it'll
Of
get
course.
added on. So,
Right, right.
So that's why there's a little nuance to it, but it's very important nuance. But I think the key part is that once you have that data, you have insight to what's working, what's not working, and where the resources need to be focused.
Okay. So now we talk about digital health in relation to Pakistan. So we've spoken about the data. That is one of the major challenges
Exactly.
that need to be
Yes,
overcome.
so I think, the main issue is that people have to come to a consensus on a unified system. you know. So this is where government can help coordinate a reckoning of what unified system should be used, you know. And once that is agreed upon, then everybody can help build on it. So that way, that when patient moves from one system to other system, their data goes with them, so they don't lose their data.
Right.
You know, so the labs know what data format to use when they give the results.
So you're talking about, you know, the age of carrying around huge files with you to
Should be
doctor
gone
to
away.
doctor. You know,
Exactly,
that would be,
that should go away.
that would make life so simple.
So simple and so effective. So there's another.
And then you lose records.
Exactly, exactly. So you
Yeah.
lose records. Even when you are going from one physician to another physician's, one physician really doesn't have the idea what the other physician recommended or prescribed. Pharmacist doesn't have an idea what other drugs you are taking. All of this helps to avoid a lot of these drug interactions
True,
that cause so
true.
much of hurt and adverse reactions in our society, because they really lead to more problems than actually ever resolving the original issue.
Tell us about these sort of drug interaction.
So what happens is that when you each drug is metabolized in different, you know, mostly liver. So many times they enhance certain enzymes when they are given. But when you take another drug which was supposed to be metabolized at a certain rate, is now being metabolized at a faster rate, it will start causing reactions.
Right.
Okay, and certain drugs don't work well. But if I don't have the full knowledge, this data is already out there. All you have to do is ping the database that, can I take this drug with this drug? And it will flag it. This is that easy.
Right.
You know, so that's why mostly in pharmacies in the US or in UK, when people go, they already know what drugs you are taking, and it will automatically flag it that this is not good. So we should advise you on a different drug, which will work with your disease better. So I think, you know, these you may think this is a very simple thing, but it can resolve a much bigger problem that the patient has on an ongoing basis.
And especially, as you know, we discussed before as well, that there's so many people who are IT savvy here in Pakistan.
So that's the other part of it. You know,
Yeah.
if you think about it, Pakistan is resource poor, but Pakistan is resource rich in IT. Pakistan is resource rich in a lot of talented people, both in medical and in information technology fields.
True.
So app development comes natural to people here. They just need to have that focus and idea to work on it to address the problems. But the problem would be that if everybody try to work that on a silo basis, your data is not transitional to other places. So one app is going to work with one maybe hospital only.
Okay.
That's where
your accessibility then
exactly
is reduced.
Absolutely.
Yeah.
So that's what you don't want.
Right.
That's where that unified system can help people interact with each other.
Tell us about China and what's been happening there in terms of digital
So
health.
just if I spent about a third of a month in China. My offices are also in China. So China, if you think about it, 20 years ago was not much better than what we have today here. But one of the things that they are very smart about is how to deploy their resources effectively. The biggest resource in any given environment, as an investor, I can tell you, when we look at any investment, the first thing we look at is people. People make the difference. And what they did was that they helped bring in a lot of what we call returnees back to China.
The reverse brain drain.
Exactly.
Okay.
They were committed. They wanted to get their country ahead. And so expats don't help much. It's the returnees who make the difference.
Okay.
And they came in, they got their, worked at the ground level. And now China has transitioned to the number 2 market in the world. I mean, this is an amazing difference within 15, 20 years. You could not imagine what the world was that far back. And so this is where, again, the challenge is high, but
how do you view the market here in Pakistan?
So Pakistan is at very early stages. As far as new drug development, new device development, we have very little role to play. We are not participant in clinical trials where new drugs are being developed. One of the key criteria to even participate that is going to be digital records.
Right.
If you don't have those, you cannot follow people.
Right.
Nobody from outside would be interested. If we don't have that, our information, our gene pool is not part of the new drugs.
Absolutely.
Which then
puts us at
a disadvantage because Pakistan is it's the 6th largest by population, and we actually don't even put a single person in clinical trials, literally.
Yeah,
so this is where we are at loss.
We need to focus here.
Our people don't get the privilege to have the new methods.
They don't have a voice.
Exactly, they don't have a voice, and then all the new drugs that are coming in, they don't have the data on dose ranges and adverse events.
Right, okay. We will get back to this conversation. We're going for a short break, but stay with us. Okay, welcome back to the program. We're having, a great discussion here where we're talking about digital health and what it means to the countries who are using it, how it has made life so, so much more efficient when it comes to terms of healthcare, saving time, money, and bringing all that, everything under one platform as we described. Now, when we talk about, Pakistan, tell us how, this can be an opportunity.
So, as we said before, Pakistan has a huge young population who are very IT savvy. Pakistan does a pretty good job in the IT programming and app development.
Okay, क्या हुआ? दोबारा? जी, audio check, please.
Audio check.
ठीक है? Okay, we're going to have to redo that because the mic went for a minute. So if you just imagine I asked you the question, so you give the answer.
So I start
You
from
start, yeah.
this side. So Pakistan is blessed with a very large proportion, actually one of the largest proportions in the world of young people who are very IT savvy. Pakistan has a very good group of developers in the app business. We have no lack of talent in the healthcare, in the medical side.
Absolutely.
It's just marriage of both of them is digital health.
Oh wow, I love the way you put that. It sounds really good.
So yeah,
sounds like a match made in heaven.
Exactly, and that's an opportunity. This is where Pakistan and excel on their own, because if you really look at the worldwide landscape on medicine development, medical device development, Pakistan is not even in the picture. So that's where
we need to make ourselves relevant.
Exactly, and we need to make ourselves relevant within our own environment.
Yeah.
We have to address our own issues.
Absolutely.
Other people are not going to come and address those issues. Our issues relate to, first of all, really deploying whatever resources we have more effectively. So this is where I think what Pakistan can really do is that once we have sort of a unified position on what setup it should be, after that, this is an open field for people to come and innovate. And that innovation is not going to be limited at all, because there is so much opportunity in Pakistan. The problems that Pakistan faces are enormous, but the opportunity is also tremendous.
So we're talking about a huge job market here too.
Exactly, especially for the young people, because they are entrepreneurial in their thinking, and they need opportunities to take advantage of. And while they're doing it, this is why actually I can tell you for myself, the reason I went into healthcare is that while you want to generate a living for yourself, at the end of the day you feel very good about it too.
Of course.
Somewhere you help somebody feel better.
Yeah.
And to me that's, and again, if you really look at it, our healthcare, market is really dedicated to being a physician or a paramedic. We have never really focused on the other end of it. Who brings in those medicines? Who brings in those devices? Who really makes them? Who thinks about the new solutions for the problems people are having? We need to transition our thinking on that side of the world too.
Absolutely. Okay, cultural relevance of the apps that would be developed.
So this is another aspect of digital health, which is very interesting. Digital apps made in Denmark are not going to be useful here. Digital health made in US are not effective here. Digital health is a very local solution to local problems.
Right.
So if you don't have that kind of input from both the culture and society, those apps are not going to be worth it. So this is why if you are going to have a digital health revolution, it would be local.
Right.
Like, yes, the framework can be provided by, an experience can be provided by other people, but you will have to fine-tune it massively to your local environment and how people react and what patient journey people have.
Right. And again, for that, you would need data, wouldn't you?
Data is everything. Again, as I said, it's the same thing. I mean, without knowing, and like in Nadra, everybody who lives where, what they do, you have nothing. It's the same way here.
True.
And the portability of data is what digital health brings. That's the other piece. If it is not portable, it would not be more effective. So you need to make sure that patients can take their data wherever they're getting help.
Tell us about personalized or precision medicine.
Yes, so this is another aspect of it. As we discussed earlier, digital health has M-Health, which is mobile health, telemed, and personalized medicine is another aspect or outcome of digital health. Once you have the data and knowledge, you can start fine-tuning the treatments to that patient themselves. So as the world is growing that data very quickly, especially on the genome level, which is what your genes can do, then you relate it to what the environment is doing. You can really start to focus on what the clear solutions are for each individual patient.
And also in the predictive factor as well.
Exactly. Exactly. So you're absolutely right in the sense that now you can start seeing that what other problems or issues maybe
cause for concern later on.
Causes for the concern later on or in the immediate future. Because once you have that kind of knowledge, and that's where AI comes in, the artificial intelligence.
Yes, tell us
Personalized medicines actually is working right now, wherever it is working, is because of the more advanced algorithms to identify the various rhythms that are in the data. That's how would I describe it, or trends, as other people describe it. So
sort of like, if we have this again in layman's terms, a person has their medical records, they have their lab tests in there, okay? And there are indicators that are showing them, you may be pre-diabetic, you may be whatever your sort of your BP's on sort of like borderline, your cholesterol, your lipid profile is also on borderline. So it's going to, with the artificial intelligence, it's going to put all that together and then alert as well.
But then you are pointing a very appropriate thing in this one, is that you said pre-diabetic. You said they are like showing signs of early hypertension, all right? What that triggers is that, what do you do about it? The issue always is that, in this field, which is personalized medicine, one of the big conferences I was asked, so so we have actionable intelligence. What do you do?
Right.
The problem is actionable intelligence only helps you guide. You have to come up with resolutions for what data is telling you is going to happen, And this is where digital health can help a lot, because this moves into what we call rehabilitation and chronic disease management. This is the realm of digital health, because that's where digital health can provide that kind of platform where people can actually manage their disease well. And rehabilitation, is a very broad term in the medical field because it really tries to take care of the 360. A pre-diabetic is not going to get resolved by taking medicines. It's going to be resolved by diet management.
And lifestyle.
And lifestyle management and exercise. That would resolve pre-diabetic people. Not like I'm starting to take some meds.
Right. So how would you address a mindset then? Because in our part of the world, unfortunately, it seems that sometimes, we have health issues that are staring us in the face. And we realize that, okay, maybe at risk for developing high blood pressure, diabetes, whatever. But then it seems that we keep it on a low priority. So how do you get people to, how do you galvanize them to understand that, health is everything?
Health is everything. So, in the developed world, the issue is that it costs the system huge amounts of money, people who delay these decisions. So they have started to work on incentivizing people who take care of it and save the system money.
Right.
Okay, so this is where
Very
that part of the
interesting.
world is going forward.
Okay.
Now take it back here.
Yeah.
People already don't have much money.
Yeah.
All right, only very few can afford the best of the best treatments. The rest basically go into financial ruin
Yeah.
when certain diseases come in.
And again, it'll
Yeah.
be when it's too late.
It's
so
too
something
late,
has just gone
and
out of
and they
hand.
lose such precious years of life with their
Yeah.
loved ones,
Quality of life as
which
well.
which they could have had if they had taken a little bit of care. But perhaps the issue is that they did not had appropriate knowledge, because it meant going to a physician. Physician doesn't have much time. They just prescribe something. They say 2 words. You should not eat this. But there is nothing to follow on with that.
Right.
Digital health can fill that gap,
Right.
where a physician cannot run around and tell you every day, hey, eat this. Your loved ones may be living far away. They
Yeah.
cannot do that.
Yeah.
But these systems can help you manage that aspect very well.
Before we were discussing, when you said if you have your sort of the exercises.
Yes,
from
so in rehabilitation, even in US,
Yeah.
when you go there, actually, say you had a back problem, which is very common in Pakistan, they give you exercises. Literally, it's 2 days when they lose the piece of paper.
That's the average time. spent
Exactly,
losing a piece
and
of paper.
after first week, over 70% of people never do those exercises, and they come back with bigger back problems, which require more surgery and more pain. So one of the things that we have as our company also invested in a company that has basically transitioned this whole thing on a digital platform, where the exercises load up on your smartphone. If certain exercises don't work, your physician can change it on the fly, and they reload on your as a prescription.
Okay.
Okay, so you never lose that. If you don't do exercises, they can see that. Your caregivers or loved ones can see that.
Okay.
That you are not doing exercises, so
Right.
you cannot say afterwards that, oh, my back pain didn't get better.
Right. So the monitoring is
Monitoring
going on.
and honesty with the system.
Oh, yeah.
Because this is the thing, because when you don't take medicines and say, I'm not getting better, you don't do your appropriate exercises or nutrition adjustments and say, it's not getting better,
Yeah.
at least there's a
You'll
way
be able
to be honest about
identify where the problem actually
Exactly,
is. It's not the medicines, it's the person, the patient. Not,
Exactly, and
taking
patients
them
have to be
properly.
motivated.
Yeah.
But sometimes motivation comes from that interaction and engagement with the caregivers, which may be your kid, maybe somebody else who is really wants you to be healthy.
So how does a hospital visit sort of, how can it be changed if you have, if you've got digital health incorporated into your system?
Hospital visits could be made more effective and efficient, So hospital visit, this is where the telemed aspect comes in. Because a lot of things could be addressed by what we call physician practitioners or other people who are involved in the system, where you really don't need to have a physician come in and talk to you. Your physician's involvement is maybe 5 minutes, because you already have the appropriate and correct diagnosis, and you may have some adjustment problems with the medicine that were given. The reaction was not good, and you needed your medicine adjusted. All of that could be handled with telemed, and not waste a lot of time. The hub and spoke model could be more effective. The hub and spoke model is a way of managing more complex and resource-poor environments, where you only bring the critical patients in a central hospital. The rest of them are dealt at peripheral clinics. But they always have the ability to tap into the knowledge base of the hub. And that also could be very well done with telemed applications, and provide that kind of knowledge to far-reaching areas of Pakistan where it is impossible for that level of expertise to go and sit and practice.
Right, fantastic. Okay, wearables. We spoke a bit about
Yes.
those. What are they? The wearables.
So wearables is growing like crazy in this space, especially in metabolic diseases management. It's just grown like crazy over in the U.S. and Europe. This is
metabolic disease management?
Metabolic disease, the most common that people would know is diabetes.
Okay.
So this is where, in Pakistan has a huge problem with that.
Is this metabolic syndrome?
No,
that's something else?
Yeah, that's
Okay,
something
okay,
different.
all right,
Yeah,
okay.
so these are diseases which are related to your metabolism.
Okay.
So, but diabetes be number one. So it's basically monitoring of the sugar, monitoring of your diet, monitoring of the insulin, if it's type 1, or other meds if it's type 2. So this really helps in getting the information on a non-stop basis to the physician.
It's sort of like a really enhanced version of your mum, isn't it?
Yeah.
To take your medicines. You haven't taken your medicines.
That's a very good simile
You're not
in the
looking
sense.
after. You're not eating your vegetables.
Exactly. But actually, the interesting part is that a lot of these diseases, it will be the kids who will be the mom.
Wow. Right.
Because they'll be, helping their parents stick to the right regimens, because that's where, diseases normally start in population at 30 plus, 35 plus. So before that, typically people are healthy. So I think chronic diseases, so actually it's their children or their brothers, sisters who can help them recover faster and lead a healthier lifestyle.
Okay. Now the execution of all of this.
Yes.
What are those steps?
So again, it's the problem always is that how you tackle these big issues. You can take them as a unending or a hill that you can't climb, or you can take that as an opportunity. So this area, with the kind of the fundamentals that it has, and with Pakistan especially, I see it as a massive opportunity for the local people here. It can create a lot of jobs and wealth while delivering on the whole focus of alleviating poverty, which is healthcare is number one in that.
Absolutely. We have such a huge disease burden.
Exactly, and that eats up a lot of wealth. It eats people's productive years in life, and the productive years are squeezed down.
The quality of life.
Exactly. So all of these things, we need to find more effective and cost-efficient ways to do it. And that's where this can come in. So I think government's role is not to do everything for you. It's always to make things be possible for you. The rules and regulations and the unification of the baseline databases and everything, that's where government can help. So provide a level playing field for all people to get engaged and be entrepreneur and innovative.
Right.
That's how mostly successful places have done it.
Right.
They don't depend on the government to do everything. The government is there to help you clean up the landscape in the sense of providing same rules for all people to get engaged.
Right.
And this is where I feel like that if that consolidation of the platforms and unified approach is identified and mandated, that would help all the providers to then focus on how can they engage in a better way. This would also help raise awareness on the patient side that I can be, help in a better way. I can lead a better quality of life because not every solution can come out of taking a pill or having an operation. We need to.
In fact, that should be the sort of one of the further on resorts. It should be, that initially we should be trying to avoid
exactly
getting into that.
If you have your annual health checkup, you already identify the upcoming problem, you should avoid it. There's no sense of bravery in this. This is what sometimes I feel like a lot of people do here.
No.
It won't touch me.
Okay, right. Unfortunately, we're coming to the end of the program, and it's been wonderful having you here and explaining about digital health. And it's really, really eye-opening, and so many things that you think that that would really, really be beneficial to for me as a person, for my family as well. So before we go, a quick message for our viewers.
The quick message is that health is a gift. And we should never waste it. Life is a gift, and to really take advantage of this gift, you need to make sure that you live a very healthy and happy life. But to achieve that, you have to do a lot of things.
Yeah.
And one of the things is that you need to start focusing on more innovative ways of in this environment to be a healthy, have a healthy lifestyle. So.
Right, fantastic. Dr. Hzw, thank you very much for being a guest on today's show.
Thank you.
Okay, and that brings us to the end of today's program. Hope you have, really been able to take advantage of the information that we were getting here about digital health and how that can help you, and the benefits to be reaped from that. But at the end of the day, it is basically about you, your choices, and how you are going to lead your life. As our guest said, why wouldn't you want to lead a happy and healthy life? All it takes is commitment. So let's be committed towards making sure that we are healthy, and our family and our loved ones and our friends are healthy too. So until next week, stay happy, stay healthy. Bye-bye.